Okay, perfect. So, good evening, everyone. I'm Dr. Somil Parikh, and I am the residency director here at New York Presbyterian Queens. And thank you for joining our student webinar. We purposely picked this day but because we know that VLSO is opening up very soon, and you guys are all going to be on there and deciding, which rotations to embark upon, your fourth year. So we wanted to just take an opportunity to introduce ourselves to you. The primary focus of this webinar will be to introduce our clerkships, okay, and what we have available to the students. But just remember this, once you're a student here and you rotate here, we've had several students match into our program here at and complete their training at NYPQ. So once you rotate here and you do a great job, and if you like us and we like you, there's a high possibility that you can even match here. I think currently we have 8 residents out of our 27 that were former students here. So with that being said, we will start with just some introductions. Again, I'm Somil Parikh. I'm the Program Director and Vice Chief of Education. I've been the Program Director here since 2016. So, closing up on about 10 years in this role. Also the Vice Chief of Education. Then we also have Anita Louie, who I'll let introduce herself. Anita, you want to introduce yourself and a little bit about yourself?
Yes. Hi, I am Anita Louie. I was kind of born and raised in Queens. I was a medical student rotator at NYPQ. I did residency at NYPQ. I did my sim fellowship at NYPQ. I was the clerkship director, the assistant program director, and now the associate program director. So as you can see, my roots run quite deep with the hospital, with the residency. And that kind of speaks volume to what an amazing program we have here that kind of keeps me coming back.
Yes, and I might add that also I think the number is like 42 or 40, 42 to 45% of our faculty here have either trained at New York Presbyterian Queen as a resident or as a fellow. So as Anita mentioned, or as Dr. Louie mentioned, once you establish your roots here, you're forever hooked. So that also then leads us to Dr. Dave Simon, who's our assistant PD. Is Dave here? Dave,
He's working.
introduce yourself.
I
Oh,
think he's working right now.
well, Dave Simon also was. Oh, and Anita, you forgot that you were also a chief resident. So Dave Simon was a student here back in 2017, then became a resident, then the chief resident, graduated in 2020, did his simulation fellowship here, and now is the assistant PD and also our critical care director. So we love Dave. There's a saying in our residency, more Dave Simon. And unfortunately, he can't be here today because he's working. But that is our one and only Dave Simon. Then we have Dr. Tim Kowong, who is here, and he's going to introduce himself.
Hi, everyone. I'm Tim. I'm the MedEd Fellowship Director. I'm the Research Director. I was a sub-high here in 2017, and then I went to Stony Brook. I betrayed this place and went to Stony Brook for residency, but I came here for MedEd Fellowship, and I've stuck around, and I love it here, and I'm happy to, show off our program to everybody.
Very nice. And you're also a research director, MedEd fellowship director. You have a lot of roles and a lot of hats. So thank you, Tim, for coming back to us and staying with us as well. And then we have Dr. Sheth. Tell us about yourself and your history here at NYPQ.
Hi everyone, I'm Sheetal Sheth. I'm currently the clerkship director here at NYP Queens. This is my 3rd year in the role. I was, you may notice a pattern, but also a student here, I think in 2016, did a residency here. I was a chief resident here. I'm also simulation trained. and simulation faculty here as well.
Yes, thank you, Dr. Shed. Yes, there's definitely a pattern, and let's complete that pattern with Dr. Brian Smith.
Hi, everybody. So I'm Brian Smith. I, again, also was a student here. I was also a resident and a chief resident. I'm currently the second-year Med Ed fellow, and I will also be staying on as core faculty next year. So again, you see a pattern here, right? We have a lot of very good people, and I think that people like working here and like being here, which is why, so many people want to stay.
All right, excellent. So that is our team today. Let us go to the next slide. So again, we could talk hours and hours about the actual residency program. Ultimately, when you come here for for a rotation, a medical student rotation, and or you come here to interview as a for residency later on, you get a whole bunch more information. But I just want to very briefly talk about the training program here. But again, the focus of today's talk is going to be really more about the clerkships and how to become a student here. But we do have a residency program here that is 3 years, okay? I know that there is a lot of talk right now about the ACGME potentially increasing all programs to 4 years. That's not finalized yet, if we have anything to say about it. But we currently are a 3-year program. If you guys come as students next year, right, and you were to become the class of 2028 in the next match, the new ACGME requirements, if they go through, would not apply to you. So this would still be a 3-year program for you, just to put that out there as well. Okay, but we are a level 1 trauma center. We see plenty of blunt trauma and plenty of penetrating trauma, not as much, but definitely our fair share of it. So we're a level 1 trauma center. We are a primary cardiac center with 24/7 cath lab, as well as a comprehensive stroke center with thrombolysis, large vessel occlusion intervention, etc. We are an affiliate of a Cornell Medical School. All of our faculty here are Cornell appointed, and we are part of the New York Presbyterian system. The other 2 residencies in the New York Presbyterian system, not to be confused with Queens, is Columbia Cornell, as well as Brooklyn Methodist. Okay, but there's also a number of the NYP network itself is quite extensive, but we have academic programs at 3 places, and we are Queens. We're a large tertiary teaching hospital with full ancillary services. So we have a number of other ACGME accredited residencies here. The 3 primary ones are emergency medicine, internal medicine, and general surgery, but we have pretty much residents and or fellows from from all specialties coming also from Cornell. So pediatrics, OBGYN, we have ortho residents from Hospital for Special Surgeries, etc. So we are a large tertiary teaching hospital with full ancillary services, in the sense that we have great nurses. All the nurses here put in the lines, draw the labs, and do all of that type of ancillary work. We also have transporters to take patients to CAT scans and X-rays. You really only get involved with blood draws and IVs if it is a difficult line that needs to be ultrasound guided, etc. So full ancillary services. We're also the receiving facility for multiple venues in the nearby area, including Citi Field, where the Mets play, the USTA National Tennis Center, where the US Open happens, LaGuardia Airport, JFK even. So a lot of venues around where we get patients from on a pretty regular basis as well. Next slide, please. What kind of program are we? So, let's talk about the spectrum of type of programs, right? On one end, you might have that inner city, urban, somewhat under-resourced type of feel, that county feel, where, none of your patients really have primary care doctors, and sometimes they're coming to the ED. That's literally their only access to healthcare. And then on the other end of the spectrum, you've got, programs or, institutions out there that are very, very well resourced, where your patients are well connected to PMDs and other, specialty physicians in the community. And, maybe that you can call that a little bit more suburban care. And that's kind of your community programs. Okay. And then you also have academic programs where, you have a med school right on campus. And those tend to be your more 4-year programs. We call those academic or ivory tower type of places. And where do we fall? We're kind of a combination of all three. So you will take care of patients that have no access to healthcare, homeless patients, even people who really are utilize the ED as their primary healthcare source. But then you'll have patients that are, actively engaged with their PMDs, which you call and you make medical decisions about patients with. And we have all of that. So many people will say we're also academically affiliated with Cornell, and we do our fair share of research. So we have the academic component. So ultimately, at the end, we're a combination of everything, okay? And you'll really get a sense of that if you rotate here. And that's one of the reasons to rotate here, because you're going to see it all. It's different types of patients, different types of people, the diversity we're going to talk about in a second, okay? So we are technically, by definition, if you had to label us, we are a community hospital, a community program with a strong academic affiliation. Okay. Our patients, our volume is very, very high, and they're very, very sick. So pre-pandemic, we were about at 125,000. The latest numbers for, I think 2024, we reached about 105,000. So slowly creeping up to those pre-pandemic levels, but we are about 105,000 visits per year. About 20% of patients that walk through our doors end up getting admitted to the hospital, but that includes all your pediatric patients, which tend to be of a lower acuity, as well as your fast track patients or urgent care patients. If you count only the people that come through the main adult ED, 40% of them are admitted to the hospital. So I think that speaks volume as to how sick our patients are. We also have 4 different ICUs in our hospital, and there is about a 1.8 to 2% admission rate to those ICUs. So if you're looking for highly acute, very sick patients, you're going to get that here for sure, 100%, no ifs, ands, or buts. We also have a very diverse population. Now, a lot of PDs, you're going to go on the interview trail, you're going to, and a lot of PDs are going to be like, oh, we see the most diverse patient population ever. And okay, fine. But many times, diversity is also conflated, or not conflated, but more, I should say, misinterpreted as the, giving healthcare to minorities. But when I say diversity here, this is literally diversity on steroids, okay? I have not seen a more diverse ED, and I've been definitely around the block. I've worked in 8 different EDs in my life, and I can genuinely say Queens County is the most diverse county in the continental United States. There's only 2 other places, counties that are higher in diversity, and that is in Hawaii. So we are literally the most diverse, county in the United States, and have the most diverse patient population. And then with that being said, they're also the nicest patients, okay? And I might be a little biased, but I've worked in EDs where, everybody seems a little bit more on the entitled side. I want this, I want that, don't touch me, call my cardiologist. And then you have patients who are not very nice and maybe violent and cursing at you and spitting at you. And yes, you get some of that sometimes here, but for the most part, our patients are just genuinely nice people who are thankful and grateful, and they're just happy to be there and receive, great medical care. And lastly, I have to put this on there because you're not going to get this in a lot of places. we have scribes. Okay, you don't use scribes for the first 7 to 8 months of your training here because you got to learn how to write notes and document initially. But then after February, so for example, in a few days, all of our interns are going to be using the scribes, and you then use scribes for the rest of your training. So this is super important. Why? Not because we don't want you to, we don't want you to write notes, but we feel that when you use scribes, first of all, that's the real world, because many times you're going to graduate and you're going to use scribes out in the community after graduation. But more importantly, our scribes, our scribe program has definitely shown us that we can see more patients per hour. We can spend more time at our patient's bedside, talking to our patients, learning at the bedside, learning at the computer, doing procedures, teaching each other, and it just overall really benefits our patients, our training, and the overall clinical learning environment. So next slide. And this is now where I'm going to turn the floor over to Dr. Anita Louie.
Right. And just to speak about how nice our patient population is, I just want to double down on that and say, like, we don't necessarily go into emergency medicine for any kind of gratitude, but at the end of an 8-hour or a 12-hour shift, when you're tired and you get a thank you and a hug from your patients, it's kind of really the best. So this is just an example of what our Wednesday conference looks like. This is a literal snapshot of the next month's conference. We have an asynchronous kind of foundation for our conference, meaning you prepare for the topics that are presented on the day of Wednesday. And I just want to plug that pretty much all of the residents, except for about 3 of them that have to work overnights, get Wednesday off. So that's kind of a nice little bonus there. But again, it is a mixture of essentially large lecture formats with administration, SPAM, which is formerly M&M. So SPAM's standing for sickest patient all month. We have grand rounds, and then we have pretty much small groups. What small group entails is 4 to 5 residents kind of rotating through each of the small groups. And we have EKG topics, fast track, case of the week. We have SIM, we have critical care, we have core lecture. And if you'll see, and I'm going to point it out, that pretty much we have SIM after every single conference. During conference, we are a very SIM heavy program, and I think it's only to your benefit that you're learning through this kind of kinesthetic learning. We're not really into the large lecture formats where death by PowerPoint, but instead you're actually learning, you're engaged and kind of involved in it. And you'll see here, you'll have the one-to-one sim, where we're actually really catering your education and your curriculum to your wants and your needs. So it's not just like a blanket simulation program. It is really tailored to your learning. And of course, we have really fun and special Wednesday conferences. So we have on the left was our wilderness escape room, which I believe Dr. Smith and Dr. Kwong will speak a little bit more about. But we do have a lot of fun, a lot of games, very kind of unconventional learning ways. We have Sim Wars. This is from last year's annual Sim Wars, which we perform in-house. And again, it's just a lot of fun, kind of doing away from traditional learning. And you're going to realize that a lot of the faculty here at NYPQ are really involved and really care about your education. And I think that's really what sets this program apart from anybody else's.
That was a great segue too. Yeah, and like Dr. Louie said, as faculty, we really care, right? And we feel like it's our goal to deliver and create like content that's interactive and educational and actually keep residents and students engaged. And we love games, like we absolutely love games at NYP Queens. Some examples of some of the things we've done: we have a Harry Potter style like House Cup where residents are split into houses and compete for points throughout the year. You can see that is our program director, Dum Parikh, over there in the middle. We also have a residency Olympics where residents compete in, we have a small Olympics for pediatrics, Sono for ultrasound, Sim Olympics for Sim, obviously, and a Smart Olympics for MedEd, where during conference, there are these competitions where houses will compete against each other for points. Again, we also do a ton of serious games. You can see on either bottom corner was one of our wilderness escape rooms that we did in a park right outside the hospital. And the pictures that Dr. Louis showed before were at another wilderness escape room that was at Flushing Meadows Corona Park, which both of them were great. And we also recently did something called board game review. So the residents are taking their in-service exam tomorrow, and good luck to all the residents that are here. And so we had medical versions of Code Names, Guess Who, Taboo, and Trivial Pursuit, and really got the residents engaged in learning while also having fun. And I think some of that passion comes from us loving games ourselves. So this is some of the core faculty actually playing our medical code names and testing it out. But because we're so passionate about games and about teaching, we're always trying to come up with like new and inventive ways to create educational content for you. And then lastly, I think wellness is also a huge emphasis of our program. What's very nice is that Wednesday after conference is protected time for the residents. So you'll often see the residents and the attendings and sometimes the students coming out and all doing events together. So some things that are here are a Feminem Pate Night on the bottom left. On the bottom right is our annual Gantry Park day, where we go to a park together and just hang out and have fun. And then the top left, I think, was a MedEd track meeting at, I forgot the name of the restaurant, but somewhere in Flushing. And then what was it? Prime, yeah, Prime, that was right. Yeah, there's so much steak, it was too much food. And then the top right, I think it's a lot of the residents going out for something, whatever it is that looks good. But the residents all going out together.
That was after a virtual social.
After virtual social. So you see, like we all genuinely like each other and we like hanging out with each other. And the fact that we have protected time after conference on Wednesdays is a really good opportunity for everyone to hang out. And we're doing our annual karaoke after IT next or tomorrow, which is going to be a lot of fun.
Okay. Well, if any of this sounds good to you or you'd like to come and check us out in person, I'm going to give you a little bit of information about our rotations. So we accept students via VSLO. Your school, if your school is a VSLO participant, you'd be able to apply that way. Sometimes it's helpful to know what the catalog code is for our rotations, and these are what they are. There's 3 rotations we offer, the main one being advanced emergency medicine, or that's our EM sub-I. And then we also have an ultrasound and a sim elective. They're all wonderful rotations, and I think you'd have a great time, but to see what's best for your academic needs. Next slide. So when you come and do a sub-I with us, you'll be working approximately 12 to 14 shifts. These shifts will be 8 or 12-hour shifts. It's a mix of days, evenings, overnights, and weekends. We do give you days off that you need for school or personal reasons. The nice thing about it is that we're a pod-based system and we only ever assign 1 student per team. So all of the educational opportunities for that team goes to the student who's on the team, as well as whatever other things might be happening in the ED. You would attend Wednesday resident conference, which you just got to see a little bit of a sample of. And then we have a separate day on Thursday mornings that we do dedicated student didactics. So for all of our students who are rotating with us, we have our core academic faculty come in and they do sort of directed to student teaching in a similar small group format. And we have divided it up into the first week might be ultrasound week, the next week will be a sim and procedure lab week, and then the third week would be a med ed week, and then your final week we would do your exit presentation and interview. I think that these are really great opportunities to get to know our faculty, residents better, and also to just build your education and EM foundations. So a lot of questions that we get is like how to succeed when you're on your sub-Is or your audition rotations. And this is the tips that I have compiled over years of doing this. And I think the first one is to be nice. People are watching you and you're there to take care of patients and to learn. So be nice to your colleagues, your other rotating students, the people that you're working with. People are watching the interactions you're having with the patients, but also with the other faculty members, with the ancillary staff. And so being nice goes a long way. Always introduce yourself to people when you're coming in on shift. They may not know that you're supposed to be there, and there's a lot of people rotating through an emergency room. It could be like paramedic students or nursing students. It could be other off-service resident rotators, and if they don't know who you are, it would be really hard for them to involve you in the care. So always make sure to take the time, maybe after sign out, to say, hey, my name is like X, and I'll be working with your team today, and if you have anything that you'd like to work on, just let them know at that time. I also, on the similar vein, recommend being on time for lectures and shifts. You don't want to really miss sign out, and being on time is like another way of showing your professionalism and that you care. I I really like Ted Lasso, but also think that you should be curious and not judgmental. And I mean that when you're interviewing your patients. Sometimes, like when you're in med school, they teach you a very formal way to interview patients. But I always think of like, what is it about their like maybe like months of chest pain or back pain that changed today that made them want to come in? So be curious about why they're here, what are the things they've tried. And I think if you have the natural curiosity, you'll sort of be able to build a better rapport and also get more information from your patients. And then I like to recommend people to follow up on their patients. It's not just enough to see them, do an HPI, maybe make a recommendation for a plan, but then to follow up on them and say like, hey, is your pain better? We gave you medicine for nausea. Is that working? Maybe if you have access to the EMR, to review the labs, update the team if the labs or imaging is back, and even making suggestions like saying like, oh, the labs are back and I noticed this abnormality. Maybe the patient should get a CT or an X-ray, and kind of like showing like how you would advance the patient's care and what the next steps would be. And always remember that you are here to learn, and I think every patient is the best learning opportunity for you. So if you're not sure about how to do a procedure, what medication they're taking, or if the team is recommending a like workup plan or considering a differential that you maybe never heard of, take the time either to note it down, look it up later, or look it up on shift if you have some downtime. All of our computers have UpToDate installed on them, and there's like other resources that you would be able to use. Because really, I think that when you're able to pair your medical education with the clinical picture in front of you, that would be the sort of way for you to maximize your time on your rotations. So sometimes this comes up that people are not sure how to give a short presentation. EMRA, which is the EM Resident Association, has a lot of medical student directed education and information. I really love this particular infographic, but you could just Google the EMRA Patient Presentation Guide. There's a QR code here at the bottom also if you want to use it, but it just gives it's a link to a paper that was done on how to do a 3-minute EM student presentation. And then this is sort of the infographic that will help you develop and have a systematic way of presenting your patients to the team. So I think now we're transitioned to some of the frequently asked questions that I have also received and maybe some helpful information for you. Okay. So a lot of times what comes up, and I would love it if anyone else jumped in here, but it comes up a lot on like, what is a slowey? How do I get a slowey? How many sloweys do I need? Again, EMRA has a great resource for you, which is this webinar where they go over their recommendations on how many sloweys you need. If anyone is unsure, a slowey is your EM specific letter of recommendation. It's a big part of your application that people review for residency, and it reflects your time on your rotation there. There's different kinds. There's like an off-service one, there's a group one, and then there's like an individual one. The strongest slowey that programs are looking for are from a group resident, like basically from a residency, a committee letter where they have like a compilation of people commenting and evaluating the student. So the recommendation is from Emra is to do at least 2 rotations. You can have one as your home institution if your home institution has a residency program, and then 1 away rotation.
There's also a subspecialty SLO too. So like with the rotation, the ultrasound one that we offer and the SIM one, you can get a subspecialty one. There's like tox and etc.
Yes. And I will add that a lot of these were born out of the pandemic when nobody could go and travel and do away rotations, and then they kind of stuck around. But ultimately, still at the end of the day, program directors and core faculty looking at your applications are really looking for those slowies, and the slowies from residency programs that are group and committee are the strongest, and go the furthest, because again, that is, we, especially like in the New York community, for example, we all know each other, right? All the PDs know each other and core faculty know each other. And so when we see a slowie from another program where you spent a whole month auditioning, that slowie goes a long, long way, as opposed to, you did a rotation at another institution that didn't have a residency, or you did, a toxicology rotation and you got a subspecialty slowie. But yes, I would say really aim for 2, at least 2 slowies from residency programs that are, group and or committee slowies.
So for us, as I had mentioned earlier, we participate in VSLO. And so this is the format, this is how you would be able to apply to come in. Unfortunately, so we partner with our sister institution, Weill Cornell, and we use their registrar to do all of our scheduling for the rotations. So unfortunately, our dates are not flexible, and you do have to be from a VSLO participating school to rotate with us. If you are curious about when our visiting student electives start, sorry, do you mind just
Sorry.
going up? The viewing catalog, which means like the rotation offerings and the dates, will be available on March 5th, which is next week. And then the applications, like the catalog will be open for applications on March 12th. You can Google the Weill Cornell visiting student elective website to be able to access any of these links. And just for the rotation, there's sort of the application is a first come, first serve. Once you have all your materials in, we review the applications, and then that's how we assign spaces. These are our rotation dates for the upcoming season. We'll start as early as June 2nd, and we go through those last block is in 2026, January 5th to February 1st. We take approximately like 12 sub-Is per block, and then 2 for ultrasound and 1 for simulation each block. And then I guess that was all oh, and our dates are fixed. I'm sorry. Our dates are fixed because we do go through the Cornell registrar, and we are unable to modify that.
I will, for example, if anybody's like furiously taking notes and or taking pictures of this, I forgot to mention in the very beginning that this is being recorded and we are going to put it on our blog, so you'll have access to it. So feel free not to take notes and just review this later. Okay.
If you have any specific questions, things that came up, anything that you'd like to discuss with me, you can reach me at our Queens student email address, which is also on our blog with NYPQ EM Student at gmail.com. Very long, but you will definitely reach us and get a response shortly. And our program coordinator is Lily, who is not here today, but an incredibly helpful resource, and this is her email address. I would just like to, this is our the link for our residency blog, which has a ton of helpful information. I am so glad that we were able to be joined by some of our residents who were also students with me. I feel very proud of that. And I don't know if they want to introduce themselves. Rose, I didn't forget you, and then say a few words.
Am I
Yes,
going first?
yes, Rose, you should go first.
Yeah, I actually didn't rotate. I'm Rosalina. I'm a second year. I actually didn't rotate here, but I went on a tour, and they sold me enough, and the in-person social as well. Fell very quickly in love with the program.
I'm
Michelle?
Rita.
Oh, Rita. Okay. Rita, no, go ahead.
Sorry.
Go ahead.
I'm Rita. I'm one of the twos as well. I rotated here as a fourth year, so I did my audition here. And I also fell in love with the place, and it was the reason why I wanted to come here. I actually didn't know a lot about the program, but then kind of the rotation sort of like opened my eyes and realized I wanted not just like for myself, but even long-term career. And so I highly recommend it as an experience.
Michelle?
Hi, I'm Michelle. I'm one of the interns. I also did a rotation here. It was one of the latter ones after doing many rotations in the New York region because I wanted to stay in New York. I fell in love with the program because not only did it have little things about every other program that I liked all in one program, but it also showed me ways that I excelled even more. It was really, really surprising and in a way that I never expected to really fall in love with the program before. So, and ended up ranking it really high, #1.
Woohoo! Very nice. Let's see, who else is here? Sabrina?
Hello, I'm Sabrina. I'm also one of the other interns. I also was a sub-I here last year. I had a really great time. It was fun getting to know everyone and just seeing how everyone was very close-knit, and was like very familiar with each other, which was very refreshing to see. I had also done a couple sub-Is prior as well. So it was very nice to see that kind of camaraderie and friendship among everyone. And then also like actually Dr. Louis talking about the didactics. I think also at NYP Queens, the conferences were like very interactive, which is very different from other sub-Is that I've been at, which is kind of like we said before, like lectures, like death by lecture almost, but here it's like much more interactive. So I really enjoyed that aspect as well.
Thank you. I think that's everybody, and I just have to, give a shout out to the four of them because you guys may or may not know tomorrow is the annual in-service exam, the in-training exam, and so they got a big test tomorrow, and probably mostly everybody is probably home, I think, cramming and studying last minute, and they were able to take this hour to be here and to talk to you guys. So thank you for. I appreciate it.
You guys are going to be so amazing because you're learning from the best residency.
Yes. Okay, where are we now? Are we at Q&A?
Yeah.
Okay, so I think at this point, we've got a good 20 minutes or so we can go over also. We would like to open up the floor for questions. We're here to answer your questions. I think you can do it a couple ways. I think I made all the attendings able to speak, but also there's this Q&A thing over here that also, okay, so I don't know if the Q&A tab is anything. This is our first time using this kind of webinar format, so I don't know. But anybody have any questions? Is the chat box open to all the attendees? I think so.
The chat is working and there's a Q&A way that you can ask questions.
Okay, perfect. Any questions for myself, for any of the core faculty, any of the residents?
I'm monitoring the Q&A. It looks like we have a question from anonymous attendee. Any recommendations for standing out during the interview trail if we are not able to get an auditioning rotation during our 4th year?
Sorry, that was really fast. I think your voice sped up. What was one more time?
Any recommendations for standing out during the interview trail if we are not able to get an auditioning rotation during our 4th year?
Yes, I can speak to that as a program director. Yes, the interview is super important, right? It's our 15 minutes, to get to know you, especially, if you didn't rotate here. So the first thing I'm going to say is exactly what Dr. Sheth and Dr. Louis said is be nice, be yourself, and hopefully that yourself is nice. So, and be honest, our interviews here are, I don't want to say laid back or casual because it's still an interview at the end of the day, but we are not a super rigid, we don't have super rigid and structured interviews. I like people to be at ease, and I like to just have a conversation. So yes, there will be some questions. You'll talk about your application and why you want to do emergency medicine, and we may have some other questions for you. But I think people can all agree that our interviews here at NYPQ are really just a chance to get to know you, and it's really just a dialogue and a conversation. It is not, and the interview is not made or designed for you to be nervous or anxious. We just want you to be yourselves at ease, and we just want to get to know you. So that's my advice for the actual interview, but definitely also come to the interview prepared, meaning you're going to get all this information that's sent to you, at least a week in advance. Most of the stuff is already on our blog, like all the videos that I sent out, I asked you to review, and things like that. So yes, you definitely want to be prepared for your interview. And that is my overall answer to that question. I don't know if any of the core faculty have any other.
Yeah, I was just gonna add something is that, like we do review and read your application. So if you do reference like a hobby or research, like I would recommend being able to speak to it. And hopefully it is something that you are passionate about and would be able to engage in a conversation. But like we do look at the like hobbies and activities portion, but please talk about things that you actually enjoy.
Yes.
There
Yeah,
was
another question. Yeah.
Go ahead, Dr. Lee.
What percentage of interns are accepted per year who are not from the New York metropolitan area? Okay, so I'm gonna say this, right? The match at the end of the day is the match. Okay, there's no rhyme or reason or rules. Sometimes people sometimes will even say it's a crapshoot, and you never know what you're gonna get. Okay, so I'll give you some prime examples. I mean, our residency right now is very like almost equal, I think, male and female. But there was one year, class of 2022, I opened up that match envelope and it was 10 dudes, okay? And 5 of them were Asian, and that just happened to be what our match was that year, okay? But we get people from all over the country, okay? So it's not that we are only looking at New York applicants. We have applicants from Florida programs, Florida schools, from Texas, from everywhere in between, California, the Midwest. Yes, we do have a lot of New Yorkers as well, or let's just say, Northeastern, American citizens, but there's no rhyme or reason, and I think every year it just differs. So I don't have a direct number for you because I think it just varies from year to year. I hope that answers your question. Okay, I think this is Sheetal's turn.
Yeah.
Yeah, there was a question around how long it takes for us to turn around applications on VSLO. So I guess there's like a few steps in the process. You have to make an account, the students have to make an account, and then your school has to review it. And then I believe they add some documents to it, like your malpractice insurance. And once the application is complete from your end and I receive it, it takes me about a week to review them and to post like, to basically accept the student for the rotation. But then that acceptance goes to the Cornell registrar for it to come through to you on VSLO. It takes about 2 weeks is the short, once I get the completed application. But just because you posted it immediately doesn't mean that it comes to me immediately, because there's some aspect that you have to do with your school. Okay.
Okay, I think this is an important one for all my osteopaths out there. So, go to our blog and see all of our residents and all of our faculty, and even the faculty that are here. many of them are DOs. Okay, I think actually today, right now, I'm the only MD even here. So we are very DO friendly. A lot of our students are from osteopathic schools. We match a lot of DOs. I will say that when we are looking at applications, again, I don't know Comlex as much as I know USMLE. I'm just going to be very honest and very blunt here. You can definitely apply here without taking step 1 or step 2, but I'm going to let you know kind of how it is just, kind of, really kind of on the interview scene in general. I think, especially schools that are both MD and DO, there is something to be said about the standardization of tests. So when you have a bunch of ND people who take only, step 1 and step 2, right? Step 1 is now just pass, fail. So it's really step 2. And then you have this whole bunch of other people who just only take Comlex 2. It's very hard to sometimes compare apples and oranges. So what I do is I do generally like it, okay, when DO students, I think we all do, even the DOs here on the core faculty can answer that question. We do prefer that you take step 2, okay? If not step 1, step 2 for sure, because there's more of a numerical value with that, and we can kind of standardize it across the entire applicant pool. But still, at the end of the day, if you don't take a step 2, USMLE step 2, and you only have a Comlex 2 score, I do have a magical formula that I use that kind of converts, your Comlex 2 score into a USMLE 2 score. And I find that it's pretty accurate, because I also find that the osteopaths that take step 2 and they take Comlex 2, they're pretty congruent. So if you do really well on Comlex, you're also going to do really well on step 2. Okay. So the answer is no, you don't have to, but is it preferred? Yes, it is. I don't know if Anita or Sheetal or anybody else wants to comment on that, but
Yeah, I agree with that. I think that it's only gonna really do yourself a disservice if you don't try to take the step 2, because it really, I don't know, I'm not saying about, I can only speak about my program, but for other programs that exist across the country, you're potentially closing doors for you if you don't take step 2. So.
let's see who's next. Okay, so do you have any insight into residency application system converting to residency CAS from ERAS? So the answer is I don't have a great insight, only because I haven't used it yet. However, you may or may not know this, but very soon, starting this Saturday, we're all going to be in Seattle for the CORD convention that we go to annually. That's our conference as educators, to learn how to teach and how to educate. And this is going to be the talk of the town, as well as, the new proposed ACGME common program requirements. So we're going to talk a lot about residency CAS. There, I've also signed up for a webinar, an actual seminar where we're going to go through the actual, the details and the kind of the inner workings of what residency CAS is. But this is what I do know. I do know that the word out there is that it is much more user-friendly than ERAS is. And the beauty of residency CAS is everything is centralized to one thing, right? So the same, right? Residency CS is not only going to have all your application materials, your picture, your personal statement, your actual application and all your letters of recommendation, but it's the same system that also lets us schedule your interviews. The day of the interview actually creates the virtual platform and like the Zoom rooms, essentially. So that I'm gonna love. I'm already seeing that as a plus, as and very good for efficiency, because right now we have ERAS, right, and then I have to I have to transport all of the ARS apps to cortex and thalamus, okay? Because that's what we've been using for the last 5 years since the pandemic, which is a great system. I think it's worked pretty well for us, but it has its limitations. And I think just having everything in one system is really going to be helpful. But there's going to be a learning curve for us. We're all going to have to learn it over the next, over the next year. But there's going to be plenty of opportunity for us to learn the program.
I just wanted to bring a question that was answered by Rita and Rosalina, that speaking about the neighborhood of Flushing, for those who are not familiar with Flushing. So Flushing is it's just like how we're a hybrid program between community feel and county feel. It's like suburbs, but city. Because our hospital is based around a residential area. So you'll have people who are living like walking distance, residents and patients living within walking distance to the hospital. It's a residential area. So there is like free parking on the streets. A lot of the students have had free parking, and there's like maybe some alternate side street parking that you just have to look out for. But for the most part, parking is not an issue. If you want to park in the lot, you can park in the lot. But in terms of things to do, it is like a mini city in itself. We're not in Manhattan, so we're not in the city, but it's about 30 minutes or so on the 7 train, and then maybe like a bus, depending on how fast you want to walk to. It's like a 20-minute walk to downtown Flushing, which is where you have, speaking of diversity, right, one of the most diverse food groups, kind of like anything that you want, right? Like you can get Korean fried chicken, Korean barbecue, you can get good Chinese food, Indian food, right? Like you can get, if you want, I don't know, Popeyes, there's a Popeyes there. So
yeah. So amongst all the multicultural stuff, there's still like Starbucks and Burger King. So you can't go wrong with downtown Flushing. The food is phenomenally insane. I just have to put that plug in. Thank you for that, Anita. And like even tomorrow after the ITE, we're going to a great place, and we're all going to do hot pot, which is just going to be a fun time. So. And there's a lot of stuff in Flushing also. Like there's Kissena Park, there's Flushing Meadows Park, there's and just being where we are, we also like Long Island is not too far away, and there's beaches in Long Island and trails in Long Island, biking and all that stuff. Mountains are also like an hour away, like upstate. They're not that far at all. We do our residency retreat. We alternate between the beach, sometimes in New Jersey, or we'll go upstate and we'll do camping and or mountain hiking, Bear Mountain, for example, Mohonk Mountain House, etc. So it's a great location because everything is at your fingertips. And when you really want to escape the urban world, you can escape very easily.
And I think Flushing also is a pretty safe area. I don't know if if anybody who is not familiar with Flushing, Queens, it's safe. Like I don't feel uncomfortable kind of walking to my car.
Yeah, I can just add to that, and maybe, more of the female residents can also attest to that. I personally have not had any residents come to me and say, "Hey, I don't feel safe," or any real safety issues. Not in Queens, not in Flushing. Definitely some other places in New York that is a concern, where people drive to work and then there's a covered garage and like there's all of that. But we don't really have to worry about that so much. I think there was also a question about the 4-year residency. Yeah, like right now, if I was to tell the few interns that are here right now that, oh, surprise, it's a 4-year residency for you. You signed up for 3 and it's 4, I think they would probably shoot me in the head. So no, it's still going to be a 3-year. It doesn't affect them, and it actually does not affect the people who match next year. This is going to start if and only if this all goes through, then that would start in July of 2027 for the match of March of 2027. So we're looking at the class of 2030, or technically I would say 2031 if it's a it's a 4-year program and you start in 2027. But it's not going to affect anybody currently here nor anybody who matches next year. Anything else? We talked about parking. There were additional resources. Yes. So I think all of our residents can, talk about that too. We have Rosh Review. We pay for everybody. The program directors and core faculty also have a dashboard where we can, monitor your progress and coach you, and we can give you different assessments. You can pick, I don't know if you guys know about Rosh Review, but it's really the way to go. I think it's the best, test question data bank out there, better than the cord questions, or there's Hippo EM, there's EM Coach, there's a number of different things. Again, I have no financial disclosures. I have nothing to do, or I'm not making any money off of Rosh Review. But I think if you asked or polled most residency programs, they would agree that Rosh Review is the way to go. But in addition to that, if there is right, so we've been, we're not a new residency. We have been around the block, and so year after year after year, we have ITE lectures, prep lectures that we've all compiled. So they're all available to you on a Dropbox. There's a plethora of information there. We also have morning reports, starting in like early January. All the morning reports are really geared towards or many of them, I should say, are geared toward preparing you for the ITE. Then synergistically, we also have the ITE prep course that is offered through Cornell, like the Columbia Cornell program. Those are on Wednesday nights. It's kind of late, 8:30 to 10:30, but at least all of our residents are off, right, on Wednesdays because they don't go back to conference. So they don't go back to work after conference. So the majority of our residents are available even on Wednesday nights, but they're also recorded so that you can watch them later. We then do also ITE lectures and conference. We also do ITE, even more fun is ITE board review. So board games, right? So like last week we did Trivial Pursuit, Code Names, Guess Who, what else? Sorry, what did I miss?
Guess Who?
Taboo.
Taboo. Yes.
Taboo.
And listen, I mean, I know they talked about gamification. But I'm gonna let you know. I mean, and again, I'm not the one who created all these games. Our core faculty are awesome. Our fellows are awesome. They know that this is how everybody wants to learn here, and they spend a considerable amount of time putting these games together and like making it. Like imagine just making a Trivial Pursuit with like 200 cards. Nobody else is doing that. We do that here, and part of my language, but it's fucking badass. So if you like to play games and you like to stay engaged in your learning, you're definitely going to get that here.
And I do want to say that I think no matter where you end up going for your rotation or where you end up doing residency, right? Everyone's going to learn emergency medicine because it's the same textbooks, similar procedures. But at the end of the day, it's ultimately how you want to learn. So ultimately, we're going to have a lot of fun doing it. And it's going to be about the people that you work with and the people that you work for. So kind of, I love this program and I chose to rotate here. I chose to do my residency here and do my fellowship. So it just really is a testament that this is a really wonderful program.
Yes. And again, I think that that's a testament to what is going on here. And with that being said, I mean, I don't want you to think that we only, hire core faculty that, trained here. It's just part and parcel of, I think, the culture here, that you feel really welcomed, and you feel something special here, and you feel like you're part of something bigger than yourself. But yes, we do have, faculty that have trained in other places, but yes, like I trained it, for example, at Maimonides Medical Center, a long time ago, two decades ago, actually. But yeah, so.
But Dr. Coam, right, from Stony Brook, Dr. Sheth did MIMO for simulation fellowship, and they come back. They want to stay.
Are there any other questions? I think I went through. Have you ever had two people, both in EM, couples match into the program?
KK.
Yes,
Wait,
yes.
what?
KKJJ.
I had to think for a second. Yes, I was like, I know we do. Yes, class of 2024 was Kristen Kobayashi and oh my God, Jonathan Jong.
Jonathan Jong.
Yes, and so yes, we have. And I would say a lot of times people might not necessarily match into the same program if they're couples matching, but they definitely match into the same geography. But yes, we have had couples. I'll even say that we've had some budding romances that have occurred in residency between residents that are now happily married and happily together. So there's definitely love in the air.
Sabrina and I like to joke that we couples matched because we were best friends in med school.
Right.
Yeah, well, you probably did.
True.
But honestly, it's funny because the four of us residents all came from the same school, Coral, Harlem. So
I just realized that.
yeah.
And we're from NYCOM, Brian, Sheetal, and I. So. All
Right.
Yeah.
Well, listen, it's 7:06. There's a big test tomorrow, and I know you guys all have things to do. But again, we are here and available. All of our information is on the blog as well. You can easily get in touch with any one of us via email. So we hope that you enjoyed this webinar, and feel free to reach out in the future. And if there's no more questions, everyone
Sorry.
have a great night. Oh, no, is there? Hold on. Did I see one more? I see a 1 on the QA.
It's a thank you.
Thank you.
Oh, it's a thank you. Okay, gotcha.
Thank you guys for spending your time with us this evening. Thanks to the residents for joining. Wish you guys good luck with the ITE tomorrow.
Yes.
Thanks.
Thank you.
Good luck to
Bye,
everyone.
guys. Good luck, everybody.
Bye.
Bye.
Okay. So just end.